Well, hey everyone, welcome back to another episode of RCCSS Chats. Once again, your hosts are Dr. Melissa Corso and me, Dr. Chris Grant. We're both looking forward to tonight's guest. He's someone who I've heard a ton of great things about, but unfortunately I've never had the chance to meet him in person until now.
So I'm just going to quickly go over the ground rules for the chat. It is a live session that we're doing on Zoom, and we will be uploading the presentation to YouTube and other social media platforms once it's done. So if you have any questions, feel free to send them in the chat box, and I will try and fit them in as best as I can as we make our way through the chat. If I don't have the chance to do it at that time, I will try and get to it at the end. So just a reminder, send the questions in the chat and we'll get to them when we can.
Okay, and I would now like to introduce our guest, Dr. Jeff Cubos. Dr. Cubos has a Bachelor of Physical Education and Health from University of Toronto and a Master's of Science in Kinesiology and Health Sciences from York University. He's been a certified strength and conditioning coach since 2002 and a fellow of the college since 2009. He's currently in private practice in Spruce Grove, Alberta. Dr. Cubos has extensive experience working with high-level athletes through various competitive sports teams, event medical staff, Athletics Canada, as well as consulting with the National Hockey League, Canadian Football League, and Major League Baseball. Jeff, thanks for participating in our chat.
Thank you very much. Can I make one comment or suggestion?
Absolutely.
And I don't know how this applies to the ground rules or whatnot, but if you guys are willing to turn on your cameras, you absolutely don't have to. But when it comes to Zoom, I find that when people are talking or it's no different than when you're giving a lecture or a talk. You want to see how the people who are listening are responding, whether they're sleeping or head nodding or whatever. So if you are comfortable doing so, please do. If not, all good on my end.
Awesome. I first wanted to start off by just wishing you a happy National Dog Day. I saw you were celebrating with your pup today.
Oh, that's every day, but I guess today with the internet, today's a formality. So yeah, thank you. I don't know. I'm sure she'll pop her head. She's sleeping right now. She just came back from daycare today.
Right on.
Yeah.
We're going to roll right into your residency experience because it was a little different than what people typically think of for the RCCS residents. Because most students think that the only option is to go through CMCC to get the requirements for that fellowship exam. And I know you did your master's to get those requirements. So can you just tell us about your experience, talking a little about the good, bad, and the ugly?
Yeah, sure. So I did graduate in 2006, and to be completely truthful, as you mentioned, like most other students, I had wanted to do the residency program within CMCC. At the time, and I'm sure it's probably no different now, at the time there were, I think, 15 of us applicants with space for 2. They ended up taking 3, and I was not one of them, which naturally I was just bummed. But because, obviously, like many of you guys, this is something that I really wanted to do. I had also applied to the external program. I don't know what it's called now, but at the time it was the external program or the sports sciences residency program through a master's or whatever. And it just so happened that at the same time, because I knew I was going to do that, I also had applied to York. So I was kind of doing my homework and just had a fallback plan just in case. So I had applied to York University and ended up getting into both programs. Luckily enough, when it comes to the master's program, the two co-supervisors who took me on, they were starting a big project with 5 other universities, looking at head injuries and head impacts in ice hockey. And so the cohort of athletes that we were studying was the age group 1 year older than the hockey team that I had been working with at the same time. So everything just fell into place. And so I would be tending to my team, and then once my players would go home after their game or practice, then I would tend to the next team and do more of the data collection and so on and so forth. So that was definitely a great, what do you call it, silver lining for me, I guess you can say.
Yeah.
And so that side turned out phenomenal. On the flip side, on the residency side, I had Dr. Glenn Harris as my supervisor, who at the same time was also working part-time with him at one of the clinics in downtown Toronto. And I can't thank him enough. I mean, my head as it is, it's in a whole bunch of different places, and to have him kind of keep me in check and keep me moving forward, I'll be forever grateful for Glenn Harris for that. And so he definitely let me have free reign on what I wanted to do in terms of what I wanted to do for my book reviews, and my case reports. Certainly helped me out with some suggestions, but definitely kept me on track. And then on the flip side of that too, he had some connections outside of the typical CMCC residency program. So because, you know, the placement with the orthopedic surgeon was full with now 3 residents, he had to help me find a different one. And I mean, I don't know how many of you are familiar with the orthopedic placements in the residency program, but what initially was meant to be shadow, you know, as much as I can in the fracture clinic and observe 1 or 2 surgeries, I observed 1 or 2 days of surgeries each week for a full year, and was at the fracture clinic every single week for a full year. So the surgeon that I worked with was very welcoming. I guess it almost helped that he was a young, athletic, into basketball, so we clicked quite early, and then also with, you know, at the same time, I would say I was quite eager. So we did some written work, submitted to a couple journals, which at the end of the day, they got denied at the last second, but I was able to present at the Fix Symposium as part of the WFC. And I think for that one, that was in Montreal with some of his work. So definitely thankful for that.
Yeah, right on. It's super important from what I've heard to have that supervisor like Dr. Harris, right? Like he's 100%. The type of guy who's so organized, and to keep you on top of what you got to do. Then, I mean, that's something that you need, right? Because from what I've heard, there can be a struggle with the structure and possibly finding those placements. So it's pretty nice that it worked out that way for you.
Yeah, and then it also helped. I mean, it probably is different in other cities, but it did help that I was in Toronto practicing, living, doing my residency, doing my master's. So I did take up a part-time, which you guys are all probably familiar with, CE kind of facilitator position at CMCC. So I led a few groups that kept one foot in the CMCC door. I did my best to hang out with the internal residents to see what they were up to see what they were reading. And then, you know, make sure that I was either not falling behind or at least staying up to speed with their progress. Because, you know, when you're independent, it's almost like working in a rural environment on your own. It's not hard to be out of the loop.
Yeah.
So I would say I did have best of both worlds. Yeah. And then with the masters, you know, working with PhD advisors from 5 different universities. I mean, I had my own 2 advisors, but I was able to liaison with a couple of PhDs from other universities. That definitely opened up way more doors than I could have ever imagined. So very grateful for that. So for those who might be thinking that, oh, I wanted to do internal, but I can only do external through a master's, I mean, you never know what that might lead to.
Yeah, absolutely.
Yeah.
I'm going to pass that along to Mel there now.
Yeah, so Jeff, I follow you on Twitter, and you're always kind of quoting books and different things on there, which is awesome. So what are some of your top recommendations for a young sports chiro like myself or Chris?
For a young sports chiro, I will say that it just depends on where everybody is at. I mean, yeah, there might be books that might be mainstays or staples, but I would say everybody has their own interests. I personally like going back to the whole being in the bubble and out of the bubble and so on and so forth. I like trying to be as expansive as I can. So going back to your question, it definitely doesn't hurt. And I don't know if the group is still reading Zakazewski's texts, but the newer versions of McGee, Zakazewski, Quillen, I think there's about maybe 5 volumes of those now. They cover it all, and that's purely from a strict, like didactic kind of lays it all out, orthopedic, sports injury. It's like an encyclopedia, I guess you can say. The volumes are like an encyclopedia. My favorites in terms of sports chiro, sports medicine, I still like Mike Reinhold's book on the shoulder. But then at the same time, if any of you have worked with Dr. Masha, on his desk will be Stoller's textbooks. So Stoller. Now they are at least $300 or $400 each, and they are thick. But I think, when it comes to having an appreciation of sports injuries and so on and so forth in sports science over and above, I guess, the general community practitioner, because reality is if you are at least a member of the RCCSS, you are going to probably strive to have a deeper understanding of sports injuries. And you don't necessarily have to be a fellow or a resident, but Stoller's textbooks, he has one on the hip, he has one on the shoulder, and he has one on the knee. And each chapter, it goes through the imaging, the pathophysiology, the anatomy, and it's laid out so nicely that, it's kind of a forever reference for all of us. So I guess, McGee's volumes and Stoller's texts, I would say those are probably 2 of my favorites when it comes specifically to being someone in the RCCSS community.
Awesome. And I know you read a lot of like non-chiro based books as well. So do you have any recommendations along that line?
Yeah. I would say the one that I recently read, which I did post online, How Doctors Think. Mm-hmm. I think not only is that good for us sports clinicians, but also clinicians in general, but it's also meant for the general population to help them be better patients. We often will face a patient who they might be challenging, and to their defense, they're just presenting how it is for them. But in a way, they're not really answering the questions that we're asking us, and we might rephrase the question maybe 5 more times and they're still not answering. And to be truthful, I don't know how many general population individuals will read this, but at least it'll give us, it gives us a better appreciation of quote unquote, as the book's titled, How Doctors Think. Another one of my favorites is When Breath Becomes Air, and that's written by, I believe he was a neurosurgeon, and I don't think this is a spoiler at all, but actually ends up being terminal himself. And, you know, the first half of the book is him writing to as he's becoming a top doctor, and then the second half of the book is him writing after he has realized his diagnosis. I know that, I guess these are kind of on the same themes. Another book I recently read was called Dear Therapists, and it's written by a psychologist. She and another individual have a new podcast out that's as well. I guess even though I'm a like many of you are a sports clinician, I think the biggest thing for us, and as we're interacting with our patients, is our relationships. So, and then a key part of relationship is communication. So anything and everything that is related to that, I would say, helps me become a better clinician. So those are three that I can think of. There's tons more.
I know, it seems like the list is never ending, right? Like you finish one and then the next one comes out with, you know, 3 other recommendations along with it. So.
Yeah, I will say that the one that I'm reading now, and I'm maybe about 50 pages in, is called The Tennis Partner. I think it was written in 2000 maybe. But if you just read the summary of that, whether it be on Amazon or in the bookstore on the back of the book, I think you guys will be hooked. So
awesome. I'm excited. I mean, my list just got longer, but it's
but
always
it never hurts to have the funny thing is, I don't know if many of you guys have heard the words Sundoku, TSUNDOKU, I believe it is, and that's a Japanese term for stockpiling your bookshelf with a whole bunch of books that you may never even end up reading.
Yeah.
But even though you open one, you're not really in the mood for that. You close it, you put it back in, you open another one. It's endless. Yeah.
Yeah, I feel that way, so I totally get that.
Yeah.
Jeff, have you heard of the term imposter syndrome?
I have.
Okay.
Yeah.
So, I mean, it's something that new grads, or myself included in this, feel some way. So I just wondered, is this something that you ever experienced, and do you have any tips for handling this or advice as you've grown out of that early stage?
Yeah. My first answer would be say, every now and then I ask myself if I have that.
Yeah.
In the sense that, I don't know, I don't think any of us, especially those of us that are on this call right now who are, you know, just curious and hungry and eager, I don't think any of us are at the point where we're so overconfident that, you know, we don't have anything else to learn. I think we're all, you know, humble and hungry enough to know that we all want to move forward and better ourselves. And so, but whenever I ask myself that question, I guess I always come to the answer that not that I am an imposter, but more so, am I giving the person I'm working with, or the individual, or the community, or the organization what they need? And then at the end of it, just like at the end of anything in life where there's a little bit of fear or hesitancy, it usually ends up turning out okay. So I will say that if there are any tips, it would be to just figure out what your foundational principles are, stick with them. It's okay to be overly basic, because when we get too fancy, I think that's when we end up risking not getting the job done. Yeah. I don't know if does that maybe answer your question?
Yeah, I think that's a fair answer. I was listening to your podcast with Scott Livingston, Leave Your Mark.
Yeah.
And it somewhat ties into it, but I really loved that analogy that you used of that building where you're starting out on the first floor. And then you, over the years, move up a floor each year. I was just wondering if you could run through that and
Sure.
kind of provide that ideology for everybody.
Okay, so it actually, I think it was earlier this year. I think I was just driving. I was driving somewhere, and then just the thought occurred to me that, so this goes back to me as a curious person. And I think, again, as I said, many of us are quite curious. But then also at the same time, me embracing uh, variety and learning from anything and everything might seemingly be irrelevant, but actually turns out able to help us with any given task or job that we're doing. So I find that, I thought that you know, the analogy that I was driving, I came up with was, think of, okay, so let's use our career, for example. So you can apply this to life, but let's use our career. We first graduate, and think of us being on the first floor of a X-story building. And so when we first graduate, we're looking out the window of a wall. Okay, so ideally that would be a floor to ceiling window, but it could be a smaller window, but we're looking out the window, and typically we'd probably be looking in one direction. So whether it be north, east, south, or west. And so let's say east, for example. So we first graduate, it's analogous to looking outside the east window of the room. In an ideal world, in my opinion, we would have a window on each side or on each wall of the room that we're in. So we would have a window on the east, we have a window on the north, we'd have a window on the west, we'd have a window on the south. I know this is going to take a little bit of time, but bear with me. So when we're looking at the east, that is us as chiropractors. We've learned what we needed to learn from a chiropractic degree perspective. If we look north, that might be us as sports chiropractors. If we, make an effort to look west, that might be us as, having an interest in strength and conditioning. And then if we look south, that might be us as, having an interest in pain science, for example. So in our second year of practice, now we're on the second floor of this, unknown building. Some of us, maybe some of our colleagues, some of our peers choose to only look east. So they're only quote unquote chiropractors. Some of us may have two windows, so north and east. So we might have our traditional chiropractic. We might also have our sports sciences interest. Some of us might have three windows, so we might have a strength and conditioning view on things. And then some of us might have four windows, which is also have an appreciation for quote unquote pain science again. Now in the third floor, so that's our third year of practice, we have some of our colleagues maybe that are just looking out one window, one direction. So they only have that, I guess you can say, viewpoint on clinical intervention and clinical management. But I find that as the years go by, as our careers increase, the more windows we have a greater appreciation for I guess, everything that might present itself. Because as you guys know, strength and conditioning might be, or is usually relevant when it comes to a sports case or an athlete with chronic pain. So the pain science piece might be important. And so now someone might be 40 years into practice and they might have only had one window, and I think they might be great at what they do, but I just find that a good understanding of many different pieces, and I mentioned this recently online, I guess, I think we should have at least a generalist understanding, but be specialists in our intervention. Yeah, and then if we want to apply that to life, I think it's important to have more than one, I guess you can say, hobby. So one might be work, one might be a hobby, one might be having a dog, one might be, building things, barbecuing, absolutely. So I hope that you know, that analogy actually made sense to everybody, but I definitely think, you know, I think life is more wholesome when we have different life, and our careers are more wholesome when we have multiple views.
For sure. Yeah. I mean, that one really hit with me, and it made me think of like the times that I do question myself as that imposter. It's like, am I just looking out that one window too much, and am I not thinking about those other windows? And
Sure.
that analogy really worked really well for me.
I mean, to the defense of many people, like it is easy to have imposter syndrome in this day and age where we're, you know, subconsciously comparing ourselves to our peers online, right? So, you know, I think the most important thing is just, as best as you can, just be satisfied with what you're doing and knowing that you are on this journey moving forward, um, and can sleep at night as you do so.
Yeah, absolutely. Kind of along those lines, what are some of the different treatment tools or principles that you use in practice, and how do you incorporate some of the different techniques into your patient care?
Yeah, I would say, um, well, hear me out. Um, I do enjoy, like many of you guys, learning and taking courses. Um, but I did get to one point, maybe about 8, 9 years ago, where I took down all my certifications off my walls, and I took them off of our website on the internet, or the techniques that I did. And this is just my own preference, because what I found was when people would call in, they would shop for, hey, I would like ART, or hey, I would like DNS and whatnot. And I felt handcuffed, that through my assessment and my history taking, that's actually maybe not what they needed. And at the time I felt that it was easier for me um, to take it all down and be able to give them what they need without kind of naming things. So to answer your question, Melissa, um, I have taken ART, and I would say that I still utilize soft tissue therapy. Having been an assistant instructor before, I will say that I'm no, you know, I haven't taken a course in a while. And then I've also taken FR and FR's courses. But at the same time, in my opinion, I think, you know, that has helped me grow all those courses have helped me grow my skill set from a manual therapy perspective. And I just felt underwhelmed continuing to go to several, not necessarily FR's courses, but other courses. I just felt underwhelmed, and, you know, I took more from learning the principles, started to learn principles from other courses. So I have taken DNS and been through the certification process. It's almost endless with naming of courses, but at the same time, I think when someone is treating all day long, I mean, there are various interventions that we'll do with our manual therapies, whether it be soft tissues or adjusting, that can't even classify it into a single technique, where it almost becomes a blend of many different techniques. So when I go to the courses now, I almost go with the intention of just trying to understand how they're thinking, and then almost look at the person in front of me from the viewpoint of, say, for example, of SFMA, from the viewpoint of DNS, from the viewpoint of, you know, FR or FRC, like especially FRC and FRA. But then at the same time, you know, I also want to know what the physios are doing. So I want to know what kind of dry needling techniques they're doing, because, you know, I can have I guess you can call them competition. I don't call them competition, but my colleagues that are in different clinics, whether they're a physio, whether they're a massage, whether even a naturopath, I want to know what they're doing, because at the very least, if a patient comes to me having been treated by them, I want to make sure that I'm understanding, so that there's no conflict on my end, that I'm not doing anything to get in the way of what they're doing over there. So, and then lately, it's almost going back to the basics of reading old osteopathy books. So there's a ton of osteopaths in our communities, and not just here in Edmonton, but in Vancouver and Toronto, that almost can out clinical us, you know. So I want to know what they're doing as osteopaths. I want to know what some of the massage therapists are doing, and then in the end, when you end up working as a team, in a, let's say, in a sporting environment, like everybody becomes on this, they all get together on the same page, and what ends up happening is the athlete ends up, let's say, working with maybe two different individuals within the same team based on their skill set rather than based on their profession. So I know that's a roundabout answer to your question, but I definitely like knowing what everybody else outside of the chiropractic bubble are doing.
Yeah, I think it's tough. Like, I found myself doing a lot of courses as a student as well, and I found it kind of just, it almost gives you too much information and you feel overwhelmed, and then you're kind of stuck trying to figure out how to treat. So I like the approach of having the idea behind what they're doing and then just trying to apply that to what you already know.
Yeah, absolutely.
You did mention working in a sporting environment, and I know we can't talk too much about your work with the Oilers, but can you tell us, what does it look like from like the big picture, what it's like to be the team chiro for a professional team?
Yeah. Okay. So I guess to preface it, I will say that at this moment, it was my relationship with them was primarily for the playoffs. So I was in the bubble for a few weeks, and now I'm out. But it's also nice to be home with my dog. So to answer your question, going back to the word relationships, I think that is probably the most important thing. And then a subset of relationship is communication, and another subset of that is trust. So I would say that I have known all the staff members for the last, I guess, 10 years now, starting with, volunteer work at the University of Alberta with their varsity athletes. And so myself, the varsity staff, so athletic therapists, physiotherapists, maybe even a couple doctors, I think, and then plus the Eskimos and the Oilers, we actually all formed a book club. So that's how we got to know each other quite well. And so we had a book club. And then so again, like I said, I had known them for a decent amount of time. And then a few years later, they had invited me to be a part of their fitness testing. And then in the last few years, I had been working with some of their players as I guess what you can say is an NHLPA consultant. So, and that's truthfully, that's thank you to Dr. Ian McIntyre, who has kind of put the trust in some of the players that he's worked with, and so sent them my name, and so I'm building relationships with some of the teams. And so many of you guys know, who've either been in sports settings yourself as an athlete or as a clinician, that players talk, that they say, hey, I'm getting work done here, you should go see him too, and so on and so forth. So and then going without breaching any privacy and definitely getting permission, it was also important for me that if I was working with some of the Oilers players, to at least give feedback and updates to the team staff, because the worst thing you could do is without risking any harm to the athlete is keep things to yourself. The worst thing you can do is keep things to yourself. So at the minimum, and some athletes are more reserved than others, and they'd say, I'd prefer you not. And then so in our discussions, they can recognize why I wanted to do that, why I wanted to update the staff each time I saw them. So that built a relationship there. And then it just so happened that, they needed extra help for being in the playoffs and in the postseason this year. So I was, fortunate enough to be a part of that. And then so as soon as I got in, what it looked like was they already knew who I was. They trusted me. And I'm not one who steps on toes. In fact, I'm kind of an advocate for not stepping on toes. But I guess it was fortunate that I knew the team from two ends. I knew the players already, and I knew the staff. So it was such a good experience on my end to be able to work together and open communication. And even now that we're out, we're still on weekly meetings and calls, preparing for next season. So if there's anything that people can take away is you never know what a little book club 10 years prior can lead to. Yeah.
Seriously. I'm going to jump over to some of your work with Athletics Canada. When you're assessing an athlete from the perspective of performance, what are some of those principles that you keep in mind?
I guess the first principle is, at the very least, having a discussion with the coach, or at least knowing where the coach is at in terms of their planning or programming or in season or whatnot. Because again, the last thing you want to do is mess someone up. Mm-hmm. Yeah, I think what we do is powerful enough that it can it can maybe not do overt harm, but and that can be physical, but that could be also mental, psychological as well. I'd say the more we say has the potential, at least to the athlete, the more we say to the athlete that, quote unquote, this is what's wrong with you and this is this and that, I think that, we can set the athlete up for disaster. So the first, principle number one is know where the athlete's at within the program. 2, watch what we say. 3, know what kind of potential negative effects we can have pre-competition, pre-training, and also post-training. So for example, like we don't want to do, this is again just a hypothetical example, too extensive work before 100-meter sprint. At least like 2 hours before, we don't want to flatten them out, right? So and then I guess the last principle is to have your own system that you are going to consistently compare what you think the athlete should look like based on where they are in their training and their program to what they actually look like in front of you. So, for those of you that have worked with Dr. Larry Bell, he's got his, 10-minute assessment system that almost looks exactly the same each time he's seeing an athlete. If you've worked with, for example, Andrea Ospina, he's got his FRA system. Shivers, they've got their FRA system that they're always going to, look at. And then once we practice our system that we've kind of molded to our own on a regular basis, then I guess you can take, I don't want to call it shortcuts, but you can cut to the chase a little bit more. So Communication, knowing where they're at in training, having a system, knowing first what negative effects we may have, and trying to avoid those. I guess those are my top principles.
Yeah, that's great. Thanks for that. That first part with the discussion with the coaches is such a simple thing, but it's often forgotten, right? It's we have this potential to be effective, but we have this potential to be ineffective, right? Or worsen what's going on there. If we're thinking the athlete needs to do one thing here, and the coach is thinking the athlete needs to do the opposite.
And then, sorry, just to add to that, I guess, and many times they already have their other therapists that they might be working with.
Yeah.
Right. So never speak ill will of another therapist. It's better to just keep your mouth shut, even if you completely disagree. But at the very least, maybe even try to find and understand why they're doing what they're doing. They could be totally way off, but because I don't know, there's just no need to speak in ill will of someone else that they might be working with. So, but going back to understanding what the coach, where they are, also understand what the other therapist is doing and why they're doing what they're doing, so you can in fact just complement what they're doing. Almost be an advocate for them. Just say like, hey, I know you're working with your physio and they're doing that. That's great, perfect. I'm going to do this as well. Maybe even let them know I'm doing this to make sure it's not interfering with what they're doing. Yeah.
We're going to jump into the last section here called Next Question. So these are just quick, like off the top of the head answers. So first off, how many dogs do you have?
I just have one. Her litter mate brother and their half sister are owned by our office manager who lives 2 minutes down the street. Unfortunately, they're moving to Manitoba in a few weeks.
Oh, no.
So that's going to be probably, I don't know who's going to be more sad, myself or my dog or my wife, but the three of us, it's not going to be a good day. So we are thinking about getting another dog. So right now I only have one. Yeah.
And what is your dog's name?
Sauvy. So it's short for Sauvignon Blanc.
Right on.
Yeah. So I'm thinking of the next dog's name. It hasn't come up yet.
Where did you grow up?
In Toronto. So my first few years of life was kind of Regent Parkish. And then from when I was 7 to, I guess you can say late 20s, I was in Scarborough. Oh. Aside from living a few years near the old CMC and then 1 year by the new CMC.
Right. Who did you have as clinicians at CMCC?
Dr. Chris DeGraw and Dr. Jason Pajikowski. If I had the opportunity to have a third, and he was one of my top choices as well, it just logistically couldn't happen because I was working with, at the time I was working with a hockey team, I would say full time throughout my entire student life. So 5-6 evenings a week, I would be going to Mississauga to work with the hockey team. But my third clinician, if all had went well, would have been Scott Howard.
Yeah, that's a great pairing. You said Glenn Harris was your residency supervisor?
Yeah, he was, and he was actually my wife. My wife's also a chiropractor too. We graduated in the same class, and so he was her clinician. So I had already knew him relatively well.
Nice. What do you do in your spare time?
Barbecue. So I have a few smokers, and a propane grill. So just before we jumped on this call, I finished up, I haven't eaten it yet, but some hamburgers and sausages. To ease my mind, I'm in the gym, which thankfully now is in my garage. So I no longer park in the garage. I've kind of built a garage gym. And then read, and without her hearing, just register for as many online courses as I can.
What's your favorite sport?
Hockey would be my favorite sport. I guess many of us grew up here in Canada, so hockey is my favorite sport. My favorite sport playing though was lacrosse.
I don't.
Yeah, it was a fun sport to play.
And who's your favorite athlete?
Ooh. I'm not sure I have one, to be honest. My favorite athlete growing up was Wendell Clark. But currently, I don't know. I guess you could say I just appreciate sport quite a bit. That, you know, that if it's on, especially if it's playoffs, oh, I love it. Yeah.
What's the best place to go on vacation?
Oh, where I went last January, not this past January, but the January before. And there's context behind it, was the Philippine Islands, the Philippines. And here's why, because I was maybe not the best place for everybody, but, you know, people talk about Bora Bora and the Maldives and whatnot. You can go to the Philippines for the same environment for less than a third of the cost. So when I went there, it was to see where my parents grew up, and so they showed me around, and so that was very special to me.
Yeah.
But even now, like, you know, a few years down the road, you know, you're thinking cottage, cabin, or whatnot. I would much rather just buy a house there for the same amount and fly over there maybe twice a year or something like that. Yeah.
Cool.
Yeah.
That's it for that section. Mel, are there any questions that popped up during the talk there?
Nothing that was there during the conversation. So if anyone has questions, feel free to send them in the chat. As we're waiting, Jeff, you mentioned when we were chatting before the chat, you have some good podcast recommendations.
Yeah. Okay, hold on. If you guys can bear with me, I'm actually just going to pull up my phone. I might as well read them out here. So Dear Therapists is one that just came out recently. It's by Lori Gottlieb and Guy Winch. You guys have to remember that some of these have nothing to do with sports medicine or whatever, but I just think it just helps us being well-rounded, and it's curious. Another one is actually by Esther Perel, and it is called, what's it called again? Give me a second. If anybody knows that, you can just shoot it out there. It's, sorry, 1 second. So Esther Perel's, is anybody familiar with it while I'm looking it up? Where should we begin? So again, if you think about it, you know, what I tweeted the other day was, you know, if you're in high performance, regardless of what industry or profession you're in, I think it's important to make sure your relationships with your friends, your family, and so on and so forth. So I think that podcast with Esther Perel is a good opportunity for us to get the perspective from people that we're dealing with every single day, that, you know, we might inadvertently be maybe not communicating well and whatnot, and you never know. And then so that just ends up translating to our relationships with our patients. I also like Neil Parisha's podcast, which is 3 books. And so he interviews typically they're authors, and they talk about their favorite 3 books. And so Neil Parisha is the one who wrote the Book of Awesome, which is a really good book. When we were allowed to keep books in our waiting room, instead of magazines, I just had a whole bunch of my favorite books, and I used that for patients to look at and read. And the Book of Awesome is a good one. Alan Alda's Clear and Vivid is a good one. So Alan Alda was on MASH, if several of you guys remember that. His is a good podcast. When it comes to specific sports stuff, Finding Mastery is a really good one. Some of you guys are familiar with that. How I Built This. Many of us own clinics, so it's nice to hear what other quote unquote entrepreneurs have done to get themselves to where they are. So let's go sports performance, you know, Leave Your Mark with Scott Livingston, Just Fly Performance podcast. And I'll give you two more. The Central Virginia Sports Performance Podcast is a really good one as well. They host a conference every year in Virginia. And then finally, they don't have many episodes, but one I also got recently listening to is called On the Edge. And I think some of you guys might find some interest in some of those. I'm not a Joe Rogan fan.
No.
No, he's too harsh for me.
He is really harsh. He's pretty
Yeah.
aggressive. We have
Yeah.
a friend and colleague who like loves the Joe Rogan stuff, so we always get clips from him.
Yeah.
Yeah. Not for
That's
me.
enough for me though.
Yeah.
Well, Jeff, thank you very much for doing this episode of RCCSS Chats. It's been really
Sure.
nice to get to meet you, and hopefully I'll get to see you in person fairly soon.
Definitely. If the East Conference was on, I probably would be coming, but maybe next year.
Yeah. Well, there's stuff in the works for that, but we'll save that for later. But I still don't think it'll be in person for a bit here.
Yeah, that's okay.
If people want to stay in contact with you or stay up to date with what you're working on these days, what's the best way for them to see what's going on?
I mean, it's always easy to email me. It's just Jeff Cubos at gmail.com, or I have another one, jcubos, Cubos at gmail.com. Engaging on Twitter and Instagram are always fun. I mean, at the end of the day, it's a nice way to, see what's going on outside in again, I mentioned earlier, it's what's everybody else doing? What are the sports performance coaches doing? Follow them on Instagram, follow them on Twitter. What is physios and osteopaths doing? Follow them online. And so I'm definitely easily accessible there. I'm not a fan of, following, and I know some people do it, follow then unfollow, so their ratio can be good. But no, I think especially if someone's new out in the field, they should have more people that they're following them than they have followers. Yeah.
And then you can find out what you're making for dinner, right?
Well, I do have a separate Instagram for my barbecue and my dog.
Nice.
Yeah, it's all fun stuff.
We'll let you get going so you can enjoy both the barbecue and time with your dog.
Sure, absolutely. Thanks for having me. Appreciate it.
Have a good night, everyone.
Okay, see you guys.